Good afternoon. My name is Janie Gordon. I'm with the Mid-Atlantic Public Health Training Center, and I want to welcome everyone to today's Public Health Practice Grand Rounds, Public Health Advocacy Campaigns, How to Win with Research. I have a few announcements before we get started for people who are watching online. Please check out our archive Grand Rounds and other online trainings. Our next Grand Rounds will be July 16th and will address public health approaches to pedestrian safety. For those watching online, you can email a question for today's presenters by clicking on the link, or you can send your email today to jlgordon, Gordon, @jhu.edu. With that, we're ready for our presentation on public health advocacy campaigns, how to win with research. And we're doing things a little differently today. I'll be introducing today's moderator, Vinny DeMarco, who will explain the format and then introduce our two additional speakers. And while to many people, Vinny needs no introduction, I'll introduce him anyway. He's a longtime advocate for public health causes, including reducing teen smoking and gun violence and expanding healthcare access. As National Coordinator of Faith United Against Tobacco, he's working to mobilize faith leaders across the country to help reduce smoking. As President of the Maryland Citizens Health Initiative, he's working to guarantee quality, affordable health care for all Marylanders. And as Adjunct Professor here at the Johns Hopkins Bloomberg School of Public Health, he's working to educate public health students from around the world on effective methods of advocating for public health policies. He's been recognized for his work by organizations such as the Baltimore Sun, the Central Maryland Ecumenical Council, and Families USA. And I could go on with his awards, but it would take the whole session. He's also the subject of Michael Pertschuk's 2010 book entitled The DeMarco Factor, Turning Public Will into Political Power. In addition to serving as president of the Maryland Citizens Health Initiative, Vinny works with FACE United Against Tobacco, FACE United to Prevent Childhood Obesity, and FACE United to Prevent Gun Violence, and Marylanders to Prevent Gun Violence. Vinny received his BA in Political Science and MA in American History from Johns Hopkins University, and he also received a JD from Columbia Law School, where he was an editor of the Columbia Law Review. So with that, I'm going to turn this over to Vinny, and stay tuned for a great session.
Well, thank you very much, Janie and Gillian and the Mid-Atlantic Public Health Training Center. We appreciate very much you hosting this. We're here today to talk about two tremendous public health successes that have occurred in Maryland over the last few years, and to talk about how they happened and the critical role that research out of this building here at Johns Hopkins Bloomberg School of Public Health had in making these public health successes. First, a little bit of background. We're talking about reducing alcohol abuse, particularly underage drinking, and we're talking about saving lives from gun violence. These are two very important issues, and as we all know, there are many, many people who die because of gun deaths, because of gun violence, and die or have horrible sicknesses because of alcohol abuse. How do we deal with these problems? We're going to talk about scientific, evidence-based solutions and how we may turn those solutions into reality. And I'm honored and thrilled to be here with two of the world's top experts on these issues. Professor David Jernigan, Professor Daniel Webster. David is really a world guru on the alcohol issue. He travels everywhere around the world, from Geneva to Africa to Asia, everywhere, talking about the issue, and is really the go-to person around the country on how to reduce alcohol abuse. Similarly, Daniel has that role on gun violence in America, and wherever you go, from Congress to state capitals to people who work on this issue in any field, they always think about what does Daniel Webster think and look at his research. So we have here in this building two of the world's experts on these issues. And what we're going to talk about is how they use that expertise to help make this progress happen in Maryland. First of all, a little bit of background. We're talking about enacting legislation in the Maryland General Assembly, which is seated in Annapolis, Maryland. And we learned from Daniel and David that the two best policies to address these issues are increasing the alcohol tax and requiring handgun purchasers to get a fingerprint-based license before they can get a handgun. Those are the proposals that we wanted to enact. And we enacted the alcohol tax in 2011 and the fingerprint licensing last year in 2013. But thinking backwards, in 2008, 2009, the word in Annapolis was, "Thou shalt never raise the alcohol tax again." It hadn't been raised in 40 years on beer and wine, and in 70 years on spirits. The alcohol lobby is extremely powerful and had built this wall that prevented alcohol taxes from being raised. Not that people didn't try. For years and years, advocates tried to increase the alcohol tax to fund programs like reducing alcohol abuse and drug abuse and helping people with developmental disabilities, but they could never do it. And the word in our state capitol was, "This will never happen." But it did happen in 2011. Similarly, as we all know, it's very, very hard to pass gun violence prevention laws in Congress or any state capitol. And in 2011, 2012, the word in Annapolis was, "You're never going to pass anything like this." There had been efforts to pass the fingerprint licensing in Maryland before, dating back to 1996, and has never gotten enacted. In 2013, it did happen. And what I'm saying to you is one of the key reasons that we got this done in Maryland is because of the research that Daniel and David did and how they were able, with that research, to help us convince the General Assembly to enact these life-saving measures. Put in a broader context, though, the research is part of what we in our advocacy community have put together as a 6-step process, which is up on the screen here. And I put it up there so you could see where research fits in. Think about this. There's a problem. Underage drinking, gun deaths. There's a powerful vested interest opponent. How do you overcome that opposition and reduce the deaths and injuries and illnesses caused by the problem you're trying to address? We've identified the 6-step process. I'll repeat them real quick. First is you come up with a smart evidence-based plan to deal with the problem. Second, you do polling to test the political support for the problem. Third, you build a powerful coalition behind your solution. Fourth, you use the media to get the word out about your solution. Fifth, you make it an election issue. And sixth, you take it to the legislature to get it enacted. And one thing I say in talking to people all across the country is that often they skip all these steps and go right to the legislature. What we're here to say, though, is that we can overcome these powerful opponents and enact these life-saving laws if we do these 6 steps, and in particular, if you do step 1 right. We can talk at length about the other steps, and Janie mentioned the book by Michael Perchik, which you can look at, which really discusses all these steps, transforming public will into political power. But step 1 is critical. You need to know what is the solution. What is the best way to deal with this problem? And David taught us that the best way to deal with this problem is to increase the problem of underage drinking is to increase the alcohol tax, and that in addition brings in tens of millions of dollars that can be used for health care and other public health needs. And the result of what we did here with David was that we enacted an alcohol tax increase in 2011 for the first time in 40 years, and there's been an immediate result of $70 million a year that's going into health care, helping people with developmental disabilities, helping reduce drug and alcohol abuse, and helping people with mental health problems. That is happening right now. In addition, David is in a process of putting together a study which will show the impact of that alcohol tax increase on underage drinking. I'll let David refer to anything he wants to refer to in there. But based on what's happened in other states, we know it's going to be successful. So this research and the 6 steps resulted in a real tremendous public health victory for Maryland. Similarly, on the gun issue, last year, Maryland enacted fingerprint licensing of handgun purchasers. Daniel will describe, I get David and Daniel mixed up sometimes. Daniel will describe in detail what that means and how it works, but I'm going to tell you some results. Now, Daniel will say it's too early to really say this is a cause, but I just want you all to know something. that between January 1 and May 31st of 2012, there were 140 gun deaths in Maryland from suicide, homicide, and intentional shootings. In 2013, during that same time period, there were 147. Our law took effect October 1, 2013. In 2014, between January 1 and May 31st of 2014, there were 112 gun deaths, 24% drop. I believe that our law is helping to make that happen, and Daniel will talk more about how. But my point here is that the research that David and Daniel did had dramatic positive public health results for Maryland. And one of the reasons we're doing this session is because the process by which I worked together with Daniel and David was so similar to me, it was eerie. Now, anybody who knows Daniel and David will know they have slightly different personalities. But what they did and how they did it was so similar that I wanted to share that with all of you because it's something that you can replicate, I believe, in Maryland and around the country. When you have a situation where you have a public health problem and a vested interest opponent and a solution that can solve that problem. So with that kind of introduction, I'm going to ask David and Daniel a series of questions that will help flesh out what they did, what we did together, and then we're going to open it up to you all. But first, I want to recognize one person in the audience, Joel Raven, who's on the board of the Maryland Citizens Health Initiative and a big supporter of Marylanders to prevent gun violence, along with his wife, Nancy, who helped us a lot. So thank you, Joel. Ladies and gentlemen, let's start with the questions, and then when I'm done, we'll ask you to ask your questions. So, David and Daniel, my first question is, tell us the evidence that you have that supports the message we gave to the public, which is alcohol taxes save lives, fingerprint licensing of hang-up purchasers save lives. That was our message, but it was based on evidence you gave us. So let's start with David.
Okay, thanks, Vinny. I gotta say, as somebody who spends much of my time in the research world, it is such a treat to get to work with somebody like Vinny. This is sort of the Mutual Admiration Society up here. But to see the research actually have legs the way that it does when Vinny really puts it to work. So I've just got a few slides I'm going to share with you. Alcohol problems 101. Alcohol, big problem. Leading drug problem among youth. Number 3, actual cause of death among Americans of all ages. About 83,000 deaths a year. About 4,300 deaths among young people. 21, it has saved thousands of lives, but it kind of hangs out there by itself. The rest of our policies fail to support it, in particular taxes. So what do we know about alcohol taxes? They reduce alcohol consumption. When you reduce alcohol consumption, you have fewer alcohol problems. They also raise revenues that can be spent on things that can mitigate alcohol problems and other health problems. And they are consistently politically popular, especially if we earmark the revenues to things that people want. Why do alcohol taxes reduce alcohol consumption? Basic law of demand of economics. If you raise the price of a commodity, demand for that commodity will decline. And in this respect, alcohol is just a regular commodity. When the prices increase, not only do heavy drinkers drink less, the general population drinks less, but also young people who may be particularly price sensitive because they don't have a lot of money. They drink less. When people drink less, as I said, we have fewer alcohol problems. This is what's happened to alcohol taxes in the U.S. These are the federal taxes, and the red line's the tax amount. The blue line is federal revenues from the tax, and you can see it's just a dramatic drop in the actual value of alcohol taxes. What this means for young people is you go to a corner store in Baltimore, and the beer is most likely the cheapest form of liquid available, cheaper than the soda pop, the orange juice, the water, and so on. The reason for this is because alcohol taxes are based on the volume of the beverage. And the volume that's in a can of beer hasn't changed over the last 40 years. So the tax hasn't changed. But every year, this industry gets a tax cut because the taxes don't increase with inflation. And that's what happens. So the federal taxes, this is just a little example, they were last raised in 1991. They've lost about 40% of their value since that time. The situation in Maryland when Vinny and I started working together on this was that alcohol taxes, the distilled spirits tax hadn't been raised since Eisenhower was president. The beer and wine tax hadn't been raised since Nixon was president. They were low in absolute terms, less than a penny a drink for beer, less than 2 cents a drink for wine and spirits. They were low compared to the neighboring states. Maryland was about 43rd or 44th nationwide in terms of the level of its alcohol taxes. And it was bringing in what my friends in budget offices call budget dust. It was bringing in basically $28 million chump change to the state treasury. So Vinny asked us to do a report. And the main thing that we did in that report was we pulled together into one place in a compelling way that was accessible to policymakers all of the available information on alcohol as a problem in the state of Maryland and on what influence alcohol taxes could have on that. This wasn't a whole lot of original research that we had to do. We did a little bit of modeling. I worked with an economist here at the school. But mostly it was just pulling together in one place. Look, alcohol's a big problem in the state. 1,278 deaths a year in Maryland. 1 out of 3 deaths of people between the ages of 15 to 20 in Maryland caused by alcohol. And then how much money would it raise? A dime a drink, which is what Vinny and I talked about. Boils it down, even though the tax is levied, by gallon of beer or whatever. That's not what people can relate to. They buy by the drink. So we break it down to the drink level. A dime a drink would have raised $214 million in new revenues for the state, would have saved the state about $249 million in terms of costs of alcohol to the state of Maryland. And then we modeled exactly how many cases of alcohol abuse or dependence, how many deaths, forcible rapes, assaults, incidents of severe violence to children, and so on. In other words, we Marylandized the data. We made it real and concrete in terms of what the effects of this would be on people in Maryland. We went through a series of the arguments. Again, this is all taxes and 21 are the 2 areas in alcohol that we have the biggest research literature. So there was a lot to draw on here. And just going through these very quickly, health and safety benefits, study after study, hundreds of studies found that if you decrease alcohol consumption, you'll have less binge drinking, but you'll also have fewer motor vehicle crashes, homicides, violence, unplanned pregnancies, hospitalizations, child abuse, and so on. The second thing is it's a fairness argument. Fairness is an economics term, but basically alcohol taxes don't cover the cost of alcohol to government. In Maryland, excessive drinking cost our state $4.17 billion in 2006, and government paid about 42% of that cost. So it costs government about 80 cents per drink, and yet the taxes, federal and state, only reclaim about 12 cents per drink. Taxes also correct for what economists call negative externalities. That is, the bad things that happen to other people because of what drinkers do. Property damage, healthcare costs, and so on. And they correct for inefficiencies in the marketplace. In the US, 2 companies control 80% of the beer market. And those 2 companies, surprise, surprise, every fall, they raise the price of beer. And nobody rolls over, nobody screams, nobody says we're going to lose massive jobs. They raise the price of beer somewhere between 2 and 4%, and all that money goes into the beer industry's coffers. Those are oligopoly profits. A tax increase could take some of that money and put it into public coffers rather than the industry's coffers. The result of this decline in the real value of alcohol taxes is that Maryland's getting less money every year. This is what's happened to Maryland's revenue from alcohol taxes over time. It is what a friend of mine calls a poorly performing revenue source. And of course, there's public support. This is a poll that Vinny did as part of that campaign. But every time we poll on alcohol taxes, a majority of the public supports them, and even more people support it if you put it to good things. The other thing we did in the report is we pushed back on some of the industry's key arguments. And one of them is that people cross the border to go shopping, another that will lose jobs, and the third is that these taxes are hard on poor people. The producers are adamant in opposing these taxes. Just in 2013 alone, there were 60 alcohol tax bills introduced in state legislatures across the US. Only one succeeded. That was in Rhode Island, where it was actually a trade. They dropped the sales tax on alcohol and got away with increasing the excise tax to make up for some of the lost revenue. In 2012, alcohol producers gave $16 million to state politicians. All right, the regressivity argument, unlike a lot of other health problems, the more money you have, the more you drink alcohol. So an alcohol tax is much less regressive than many people think. In fact, because the binge drinkers are most common among people who make $75,000 a year or more, the tax will have the biggest impact on that group, substantially smaller in group on the lower income, smaller impact on the lower income groups. So our second report, we did a second report for Vinny, and this focused on these economic issues, we estimated how much productivity would increase as a result of the tax. We also did some calculations and were able to show that most Marylanders, 40% of Marylanders don't drink. They would pay no additional tax. An additional roughly 35% drink in a relatively low-risk manner. They would pay an average of $10.83 per year as a result of the tax. The quarter of the population that binge drinks, that is self-reported drinking drivers, that are the people whose consumption you want to go down, would pay the most of the tax. They'd pay about $153 more in tax per year. That's exactly where we want the burden to fall. We also looked at cross-border shopping, and what we found was very mixed literature there. And in any event, mostly what happens with cross-border shopping, especially with high gas prices, is it decays over time. By about a year after the tax, people are no longer driving 20 miles to get a cheaper case of beer. So the bottom line, there was a lot of research that we could summarize. There were high-level reports that we could bring to Maryland legislators, and I'll just close with this quote from the Institute of Medicine. When they were asked by Congress in 2003 to put together a report of the best ways to reduce underage drinking across the U.S., they concluded that the failure of alcohol excise taxes to keep up with inflation has considerably exacerbated the underage drinking problem, and that raising these taxes at both the federal and state level is justified by established principles of public finance, by public health considerations, and by the specific goals of Congress in creating that IOM committee. I'll turn it over to Daniel now to talk about the evidence on guns.
Before you do, David, I just want to highlight one of the words that David used. He Marylandized this report. That is so important. Before this report was done, there was lots of evidence nationally that if you increase the alcohol tax, there'd be less underage drinking. But what did it mean for Marylanders? And that was so important for the public, the media, and the policy makers for that. And actually right now, David and I are talking with people in other states, urging them to do these same kind of reports to build the support for an alcohol tax increases in those other states. The critical piece is, what does the research show will be the benefits in your state, in your community, from increasing the alcohol tax? Let me ask you, David, before we go on to Daniel, how did you fund it? Where did the money come to do it?
There was a local foundation with whom you had a relationship.
The Able
Foundation. The Able Foundation. And the Able Foundation very generously agreed to provide a small amount of money to support both of these reports.
Right, and there are foundations in Maryland and other states who are interested in these issues, and I think the potential is there to do these kind of reports in other states, but make sure it's specific to your community. So let's turn it over to Daniel on fingerprint licensing of handgun purchasers. Thank you, Dave.
Okay, is this mic? Okay. So there's definitely some similarities between the what we accomplished in 2013 on guns in Maryland and what was accomplished in 2011. Yes, on alcohol. And there's some similar ways to think about it in ways on the gun side that are very analogous to the points that David was making as it relates to alcohol. Vinny has sort of focused on fingerprint licensing for handgun purchasers, which I think is the most critical thing that was accomplished in 2013. But I want to say that that piece was part of a broader package called the Firearms Safety Act of 2013 that included a number of provisions, one dealing with assault weapons and large capacity magazines, another having to do with strengthening our laws relevant to individuals who might be dangerous as a result of mental illness. And then there was a set of policies that, in my language, I like to refer to as firearm seller accountability measures. Fingerprint licensing of handgun purchasers being the central piece. But there were two other parts of that in the legislation that I also think is important and also relate to the research that I talked about when this policy was being discussed in Annapolis. And those two other pieces have to do with licensing and oversight of retail gun sellers. Maryland did have a law that required state licensing of those businesses. However, the way in which that law was written was quite unfortunate in that it gave virtually no leverage of the state police to actually take action when firearm sellers were not following laws for the most part. And so we had many examples of local dealers, and because our federal laws are also very weak in holding gun dealers accountable, we had gun dealers who were, through their negligent practices, putting many hundreds of guns onto the streets into the hands of dangerous people. And it was a huge problem, something that I had been working on for a while. So with this act, they gave a lot more authority and leverage for state police to act when you have a problem gun dealer that was funneling guns to criminals. So all of this was part of a bigger package. 2013 was a very important time for gun policy generally because of the tragedy in Newtown, Connecticut at Sandy Hook Elementary. We, as many of you know, put together a symposium and a book that put all that evidence together that also is sort of a nice recipe for doing precisely the kind of things that Vinny is talking about and what this session is about. But getting to the specifics of sort of my role as it relates to strengthening the laws in 2013 I'm going to focus on what I'm again referring to these firearm seller accountability measures. We had done prior research showing that permit to purchase licensing of handgun purchasers was probably the most effective single policy to prevent the diversion of guns to criminals. Shortly behind that was tight regulation and oversight of retail gun sellers. And we also found that these laws requiring mandatory reporting if you're a gun owner and you lose or have your gun stolen, that you report that to law enforcement. All of those policies were shown to have fairly strong relationships between fewer guns being diverted into the hands of criminals. And that was really pretty central because that is the mechanism by which the laws save lives. Vinny keeps coming back to the saving lives, which is really important. But in my line of work, you have to connect all the dots, because there's a lot of things that can reduce gun violence. And whether it goes up or down, there's people pointing fingers in a variety of different ways and saying, oh, it has to do with policing, it has to do with this, that, or the other. And my job as a researcher is to try to disentangle all those factors and try to figure out what is the actual effect of policies. And when we've done our research as it relates to permit to purchase licensing and other laws, we want to know whether these mechanisms sort of line up. Is there evidence that there's fewer guns being diverted into the hands of high-risk individuals, criminals in particular? So we did not have the same kind of time, luxury, and necessarily resources to do the full kind of reports that David was able to do so successfully on the alcohol tax. Okay, I guess is this on? Okay. So we did not do full reports. What I did and our center did, we did short fact sheets on the key policies. I, of course, testified in Annapolis when there were hearings. But another thing that I did when Speaker Michael Bush was formed a task force of legislators to come together after the Sandy Hook tragedy and figure out how can Maryland strengthen its laws. I was invited to come and speak to that group, and I was able to bring the book that we had published in February of 2013. And it proved to be quite important, because there was a chapter that specifically focused on permit to purchase licensing and put all the evidence in there for them. Things were moving fast in 2013. We were working on a number of different levels and issues in Congress and in other state legislatures. We did not actually have fantastic data and research connecting the dots to these policies and fewer lives or lives being saved by them, partly because A, very few states actually had these policies in place, B, most of those policies were passed many decades ago. There were only 2 relevant policy changes to study, and it just so happened that we had been funded by the Joyce Foundation to study those 2 changes. And so we were sort of in midstream when all of this got going. So we had to sort of hit the gas pedal, move forward, because the time for our research was now, not whenever we got it done and published and so on. So, so after meeting with the group in Annapolis, and I think I was persuasive in saying these laws really keep guns out of the hands of criminals, a skeptic among the legislators said, yeah, but they'll just find guns anywhere. It's not going to make any difference on gun violence. So again, we moved forward very quickly in looking at when the state of Missouri changed its laws to get rid of handgun purchaser licensing. They had had that in place since the 1920s, and in 2007 their legislature and governor signed bills to do away with that. So that protection, I guess I probably should have just sort of explained what licensing is. I'm sorry, I got ahead of myself. In most states, if you're going to purchase a firearm, you have 2 kind of general options. One is you can go into a licensed gun dealer where you'll fill out forms, they'll do a background check, and you can purchase the guns in that way, provided you're not a prohibited individual. Or you can go to a private seller who has no obligation whatsoever to make sure that you are actually a legal purchaser and there's no record keeping. So it's no wonder what choice criminals and traffickers make. One way in which to achieve what generally most experts agree is the critical missing link in our current gun policies, which is universal background checks, is to require licensing or issuing permits for licenses to purchase firearms. And in many states, they focus specifically on handguns because they're very much overrepresented among different types of firearms. So Missouri had such a policy in place. If you wanted to purchase a handgun in that state, you went to a local sheriff's office where they directly did the vetting, as opposed to go into your friendly gun shop or these other options. So you could imagine why the environment would be different for getting guns if you were a prohibited person, whether you had licensing or not. So I'm going to show a few slides just to sort of illustrate what we found in our Maryland study. This is admittedly a busy slide. This has to do with the diversions of guns to criminals over time. The policy changed in late 2007. And for sake of time, I'm not going to go to the specifics. But basically, these data from firearm trace reports indicated that there was a twofold increase in the rate of guns being diverted to criminals soon after a retail sale when they repealed this law. A similar type of thing we found in these gun trace data was that the share of guns that had been used in crime that originated from sales from Missouri gun dealers increased quite abruptly and dramatically in response to this legislation. This is a marker that basically never changes in most states. It's incredibly stable, and you saw a quite dramatic change from roughly around 55% to about over 70% over the course of the study. And we also saw an increase of guns that had originated in Missouri with less controls over these sales that are showing up in the hands of criminals in nearby Illinois as well. Let's get to the bottom line of gun deaths, however. We looked at murder rates over the period of time for which we had data, and we found that there was a distinct diversion in these murder rates that coincided perfectly with the change in Missouri's law. What you see here in this graph is that Missouri's rates of murder increased slightly at the same time that there was fairly substantial reductions nationwide in its murder rates. And there was a particularly large spike just following the repeal of the law. We looked at, well, perhaps there's some regional phenomenon. Basically, what I did as a researcher is try to rule out other explanations for why did Missouri have such a big spike in its murder rate that coincided perfectly with this policy change. And I thought, okay, maybe it's a regional phenomenon. Missouri is actually, there's no state that has more other states that touch its border than Missouri. Right? Fun fact, okay? So I looked at all of those states that touch Missouri, and none had a statistically significant increase in its firearm homicide rates, whereas Missouri had a quite pronounced and large statistically significant increase. If you look at it overall, there was a 25% increase in the firearm homicide rate in Missouri, whereas nationally there was more than a 5% decline, and in the border states from Missouri, 2.2% decline in its firearm homicide rates. Another thing to rule out was, well, maybe something went on where they had an incredibly successful, say, gang violence intervention in St. Louis or Kansas City. Maybe there's a very localized phenomenon. What we found, however, is that these very large reductions in gun homicide rates extended through all parts of the state, at least with any kind of significant population. The numbers are too small to really look at this in the very small rural counties. David mentioned public support for alcohol tax increases. We also had done polling. This was before Maryland's law specifically, but in order to look at this nationally, we found not only very strong support among across the board for universal background checks, but for licensing of gun owners as well. So we did do more statistical analysis where we systematically ruled out these other explanations, levels of policing, other public policy changes, changes in employment. We statistically controlled for all of them, and what remained is an incredibly large effect from that policy that translates into about 50 lives lost per year as a result of the repeal of the handgun purchaser system. We have some current research that we're doing on Connecticut. When they adopted this type of policy, it's not ready for prime time yet, but the data are quite consistent with what happened in reverse in Missouri when they repealed the law. There was a clear reduction that will, when it's all said and done, will translate into hundreds of lives saved as a result of the law. So I was able to share that information and answer the questions. The critical stumbling block for moving gun policy is not that people don't understand it's a big problem. Everybody knows gun violence is a big problem. It's not that there's disagreement that some people want dangerous people to have guns and some people do. Nobody wants dangerous people to have guns. The critical thing is one group there says it's impossible. It can't work, okay? Bad people are always going to find their way to get guns and kill people. So why bother us with your inconvenient gun policies? That's why it's so important to do this research. The only way that you really know is to do the systematic, rigorous research to basically prove that this works.
Thank you very much, Daniel. What you heard from Daniel and David is how important and effective these two policies are. The alcohol tax increases and the fingerprint licensing of handgun purchasers, how important they are in saving lives. But let me build off what Daniel just said. There are many people in the public who would like to do something about gun violence, who would like to do something about alcohol abuse, but have no idea that there are effective policies out there. In 2008 and 2009, leading up to us enacting our alcohol tax, I can tell you that the key policymakers in Maryland, including those who supported our law, those who sponsored our law, the advocates pushed for an alcohol tax, none of them knew that alcohol tax increases would reduce underage drinking. They wanted the alcohol tax for the money, like any other tax. But they had no idea that it had this independent public health benefit. Similarly, in 2012, beginning of 2013, policymakers in Annapolis and Maryland did not have any idea that fingerprint licensing was an effective policy. They had never heard of the policy. So how did we take these effective tools that David and Daniel talked about and turn them into policies that we got enacted? Well, the first step was educating the public. And the best way to do that is through the media. So we did a lot of work with the media to get the message out that alcohol taxes save lives and the fingerprint licensing save lives. We did press conferences, we talked to editorial board writers, we did everything we could to get the message out. And I'd like for David and Daniel to talk to you a little bit about their perspective on this media outreach and how, as a researcher with our assistants and working with our organizations, they use the media to get their message out in Maryland. Start with David.
Sure. I mean, Vinny is the master of media advocacy and refers to it as a giant telephone that can help him phone millions of people. As I said at the outset, it's incredibly gratifying as a researcher to be able to get your findings out before the public. One of my great frustrations working in alcohol is that we've got so much research and most of it sits on the shelf. And a good example of this, in the Maryland case, the federal government requires that every state have something called a state epidemiologic outcomes working group, that it compiles data on alcohol, tobacco, and other drug use. And Maryland had one of these. They'd done a lovely report. It had gotten buried. It was buried in a state website. It had so much of the data that I needed in order to put together that report in Maryland, but it was buried and it had to get pulled out. You had to know you have to have some sense of what is going to move a policymaker, what pieces of information are going to be most salient to them. We learned a long time ago on alcohol, even though it's a huge problem across the age ranges, that people care more about young people than they do about adults dying from alcohol-related causes. They just do. Young people are viewed as more innocent, more vulnerable, etc. So fine, we stress the young people statistics. Vinny's question was specifically about the media, and I gotta say, the first press conference that we had about this, I just watched Vinny himself in sort of awe, because every time the cameras were on him, Vinny said 4 words: alcohol taxes save lives. We're here to tell you alcohol taxes save lives. The purpose of this press conference is to underscore alcohol taxes save lives. We have one message today: alcohol taxes save lives. And he just said that over and over again. I provided the filigree, okay? I could provide, in fact, 1 out of 3 deaths among 15 to 20-year-olds in Maryland is caused by alcohol. So those are the lives we could save. In fact, this tax will save 37 lives a year in Maryland. Things like that. I could provide the specifics. Vinny was providing the larger frame.
Daniel?
Again, there's some similarities and some differences. Our center is blessed to have a communications director who's wonderful, Alicia Samuels, and she's fantastic in terms of making the contacts, helping get, again, 2013 was a very crazy time for gun policies. There was a lot of demands, but she was incredibly helpful to make sure that I got to the right people so that I could talk to them. Vinny and I did not have joint press conferences, as was the case with the alcohol tax. I have felt, Vinny is a very long-time friend of mine who I admire and respect deeply, but I feel it's incredibly important for me as a researcher and for our center to have independence. And so we did not have press conferences, but we responded a lot to media requests. We put out things that were friendly for the media to understand what the policies were, what the evidence behind them was. And I very slowly over this time learned to be able to, with some help from David, be able to talk more in a more media-friendly way. And so I was able to connect these dots of keeping guns out of the wrong hands. Again, trying to make this not a cultural battle. The reason, in my opinion, that gun policy stalls in so many cases is the media frame is a cultural battle. There's one group who loves their guns and will, you have to pry it from their cold dead hands, and another group who would like to just melt all the guns down and take everybody's guns away. That's not a particularly helpful policy frame in which to work. And so what I try to concentrate in the way I deliver my message to the media is to break through the cultural debate and say we have a policy debate in which we basically have an enormous amount of agreement. Nobody wants dangerous people to have guns. What's the most effective way to do that? And sort of keep it at that level and keep to the evidence. And that, I think, was probably the most important approach in order to be able to come across and be a credible researcher in the policy environment.
So I want to just 3 quick points on the same thing. I want to talk about availability, timing, and independence. So first, availability. We're in academia, we teach, we've got all sorts of other demands on our time. This game only works if you're willing to be available when the media is biting. And I think this is something that for both Daniel and I, we got used to Vinny calling us at all hours of the day.
3 in the morning.
Yeah. And we also, when they need you, you've got to respond quickly. And that's the timing piece. That it's not a question of, well, that research isn't ready yet. You've got to find the research that is ready, or you've got to find a way of framing what you've got so that it can inform the debate, because the policy window is going to close. That train's going to leave the station. So, and the last thing is, Daniel made a really good point about independence. I'm not Vinny DeMarco. At the end of the day, I live here in academia. I am a researcher, and my little story about independence with Vinny has to do with the title of the first report. So I'm just going to flip back through here real quickly, just so that folks at home can know this is where you can go to actually find the reports. Vinny wanted to title my first report, guess what? Alcohol taxes save lives, okay? And I successfully argued to Vinny, no, it needs to have a much more dispassionate title, what he refers to as the world's most boring title. But, you know, it was something called, I think, you know, the potential benefits of alcohol tax increases for the state of Maryland.
Is everybody asleep?
Okay.
That's great. I love that.
Yeah. So, independence.
Well, the press release under which that was on top of the report said alcohol taxes save lives. But at the press conference where we released this, David did this brilliant thing where he had one of the people in our office run down to the neighborhood 7-Eleven or wherever, or wherever they sell, and buy a beer, a soda, and an orange juice, and we put their prices in front of them. And the beer was the least expensive, and that was really good for the media. The other thing that
It's hard to make taxes visual.
Yes, but that did it. The other thing that David and Daniel did so well was talk to the reporters, I referred to them, and the editorial writers. The editorial writers of The Sun and The Post were very interested in these stories, but needed the basis for what they were going to write, and David and Daniel did a great job. And if you look back through the time of 2013 and 2011, you'll see tons of Baltimore Sun and Washington Post editorials supporting our alcohol tax and fingerprint licensing laws, sometimes even mentioning David and Daniel and their study. So that was great.
Well, people often wonder, where do these editorials come from? How do you get an editorial? Well, people write them.
Yes.
And those are editorial writers, and you can learn their names, and you can send them an email, and if your topic is topical, as these were incredibly topical, they'll be interested in talking to you. And then, you know, once they're talking to you, it's important, as Daniel pointed out, it's important to know how to talk to the media, to know that they're not going to be that interested in p-values. They're interested in the bottom line and how it affects their readers.
Let's move on to legislature and how these two gentlemen, these two professors, dealt with the legislature before we answer your questions. It was just incredible to me how effective Daniel and David were in the legislative process from their research perspective. They were not advocates. They weren't there lobbying the legislators as I was, but they were providing key information. And there were three specific key things that they both did. One was have a meeting with who I think is one of the most important and effective leaders in the Maryland General Assembly, House Speaker Mike Bush, who is a tremendous public health leader. He was very, very skeptical about alcohol tax increases. He had been a big supporter of tobacco tax increases. He did not know anything about alcohol taxes and why it was different than a sales tax or gambling or any other kind of revenue measure. Similarly, he did not really know fingerprint licensing. He knew after Newtown that something had to be done. He had not heard about this policy. So a meeting that David and Daniel had with him was very important. I'd like them to talk about that. Secondly, they did a great job at the hearings. The hearings were the time when you formally present your case. Yes, that's not dispositive. You got to talk to individual legislators, but it's very, very important. You have to have a good hearing. You have to lay out the case. You have to answer the tough questions. Both of them did a great job for that. And third is be available for questions, including at incredibly late hours and early mornings during an issue would come up on the floor of the House or Senate, and somebody would say, what's the answer to this? Why is fingerprint licensing so important? So I called Daniel, I remember once at midnight, and said, Daniel, can you answer this specific question? And he did, and that helped answer the question on the floor. And during the alcohol tax campaign, there were constantly times when the Speaker's office or somebody would say, we need to do this a little differently. What do you think of this? And I had to call David. And no matter what was going on, David made himself available to answer that. So I'd like the two of them to talk about a little bit their relationship with the legislature?
Well, first we should tell our Speaker Bush stories. So my Speaker Bush story is, I mean, Vinny had put together this gigantic coalition, all these amazing groups, you know, AARP, labor unions, clergy, etc. And I was just sort of one lone research guy from Hopkins. And so we got a meeting with Speaker Bush. Vinny did not come. So I was there with other members of the coalition representing much larger constituencies than I. We got into the meeting. We all sat down. Speaker Bush turned to me and said, "Now, Professor Jernigan, on page 32 of your report, you said," and I almost fell off my chair because he'd actually read to page 32 of the report. You know, I put these things together with a one-page executive summary on the front end. That's everything in that executive summary that I want a policymaker to know, because you can never guarantee that they're going to read all the way through. But he was particularly interested in the regressivity issues. We knew those were going to be a hot button issues, and so we had included a whole section on regressivity in the report. We were ready.
So as I think I mentioned earlier, when early in 2013, when the legislature was considering what it was going to do on guns, and Speaker Bush really stepped up in the leadership role, he convened a task force to look at this. And I was asked to come speak to that group, which I was very pleased to do. And I brought copies of our book. And I'd been going and testifying at hearings on a variety of gun bills for roughly 20 years in Annapolis. It's a very different experience, a hearing, as opposed to we're just now sitting down as a task force to talk about evidence. And the guys who, you know, perform for their audience to try to, you know, take their whacks at the Bloomberg school nerd, they were actually polite and nice. And I was able to have an actual conversation and exchange of ideas and understand what they were concerned about, what they didn't understand, and I found that actually really wonderful. It was a very different thing when we were in the public view, cameras were rolling and all that kind of stuff. But I found that very helpful to really get to the facts of it, and it was a really important thing that I think Speaker Bush did. The hearings, you get 3 minutes. And again, I've been practiced at this for a while. I've been doing this before. And so I get up and I give my main points. But the main thing is I have written testimony and other materials so that whether it's media or legislative aides or whoever, they have the data available to them, and we can respond to it. But the key in all of these hearings, as David alluded to, is you're coming there as a provider of facts. It's a different role than what Vinny is or some other advocates. And you really have to keep your cool, stick to your facts, and if you don't have data to sort of back you up on a question that they're answered, you simply have to say, I don't know. Do not make stuff up.
Yeah, no, that's absolutely critical. I spent a couple of days in the legislature just going around and meeting with individual representatives, and you know, they were sort of hard days because they saved up the hard case ones for me. So these were all quite skeptical, but going into those meetings, I had learned a long time ago the media can only deal with 3 things. So when I talk to the media, I have 3 key points. Legislators, I had a little more time, so I had 6 key points, you know, on a piece of paper in front of me. If we had time, I'd get through my 6 key points. But the point is, really, you know, I've spent 25 years working on alcohol policy. I could talk until the cows come home about the research, but picking those 6 key things that I thought were going to be most salient to the legislators considering this in the state of Maryland in 2011, that's what I focused on in those meetings.
And let me just say that what Daniel and David did in those meetings and these conversations was absolutely critical. And let's stick with Speaker Mike Bush. He was skeptical about both of these policies when the 2011 session started on alcohol tax and the 2013 session started on guns. He did not know about fingerprint licensing. He did not know the research on alcohol taxes. David and Daniel effectively explained them to him, showed him the data. He became our biggest advocate in the General Assembly for both of these policies and really played a critical role in the politics of getting them enacted. Similarly, I would be constantly talking with legislators who would be saying, yes, I heard that from David, or I heard that from Daniel, and that makes sense, and if they have one more question, I would get it answered. But I can't emphasize to you enough how critical what David and Daniel did was in getting these laws passed. Now, I don't want you to think that that's enough. And before we open it up to questions, I want to emphasize something here. What Daniel and David did here with this research is necessary but not sufficient. We also had to build a powerful coalition. We had to have the rallies. We had to have the faith leaders, law enforcement folks, the ARP, NAACP, and everyone else, the medical societies, everybody saying, you need to do this. We had to make it, and to use a phrase we used a lot, good policy and good politics. We had to make it so that the legislators understood that this would save lives and maybe save their necks in the election to support this. So I think that people who want to pursue a public advocacy, health advocacy campaign like we did, need to first find a researcher like David and Daniel to give you the basics and then build on that with the coalition and the media and everything else. So I think at this point, we're ready to answer your questions, both the people in this audience and the people online. And let's start with people in this audience. Why don't you, if you have a question, your name and... Oh, okay. Thank you, Gillian.
I'm Anne Marie O'Keefe. I teach public health at Morgan State University. How did you deal with the bad guys, the opposition, the NRA, the alcohol industry?
Well, let me first say, Anne Marie O'Keefe is also a great leader of the Maryland Public Health Association, and we thank you for all you've done for public health in Maryland. Before I turn this over to David and Daniel, let me just say that my philosophy is to ignore them, is to make believe they don't exist. We have a policy that works. It will save lives. It does not do us any good, I believe, to attack the NRA, the alcohol lobby, or anybody like that. In fact, anybody who was at our gun violence prevention rally in Annapolis knows that I took down the anti-NRA signs. We did not want them. We have a positive message that will save lives. When they raise objections, we answer them. But our philosophy is, at least mine, is to ignore them. David and Daniel?
Well, and in the alcohol tax campaign, our version of that was we simply stayed on our message. It was a two-session campaign, and the industry really trotted out all their best arguments in 2010, which made us even more ready when we came back in 2011 to be able to rebut their arguments and make that part of our message. It was actually, apocryphally, we've been told over the years that some of the alcohol companies write into their state lobbyist contract, if an alcohol tax passes in the state, you are fired. That's how seriously they take the alcohol taxes. And so, I was expecting the arguments we got. I was certainly expecting that they would have worked the legislature thoroughly to inoculate them against what we were trying to do. But the main thing we did is we stuck to our message. We stuck to our public health message. And on alcohol taxes, it's not a frequently heard message. And I'm going to sneak in another point here, Vinny, which is These campaigns are such a huge opportunity for health education, even of our friends. Daniel referred to the myths that you have in the gun field, where, one of the myths is it's impossible. You can't keep guns away from dangerous people. I mean, the myths in the alcohol field are, kids are going to drink no matter what. Or we should just, drop the drinking age and be like Europe. God forbid we should be like Europe. You should see how many kids are dying in European countries. But that's another whole lecture. But the point is there are lots of myths, and our friends in public health, in these coalitions, in the faith community, in labor unions, etc., they're as subject to the myths as anybody else. And having that public health voice in there, backed by the most solid of research that we can find, is so important in terms of not only getting this policy passed, but changing the landscape generally around these and framing them as public health issues.
My approach as it relates to the gun lobby is very similar to what you're hearing from Vinny and David on the alcohol lobby side. I never, in anything I put out, directly say anything about the National Rifle Association or any other organization of that type. I do, however, as Dave is alluding to, there are arguments that come principally from those lobbies, and in my case the gun lobby, that if you're going to be effective, you have to refute. You have to say this is a myth. And as David was saying, in terms of educating not only opponents but actually allies as well. Again, I think I've always felt, well, not always, for a very long time, I felt that the biggest hurdle for advancing stronger gun policies is a disbelief that they actually work. We're sort of trained every time we pick up a newspaper or turn on our evening news. So commonly we see tragedy with guns and the result of dangerous people having guns. And it's no surprise why people would therefore conclude this is impossible. Bad people are always going to get guns. But we cannot, it's not newsworthy when someone does not get a gun. So mostly how I approach this is there are sort of two issues from the opponents, NRA or otherwise. One is you can't keep guns from bad guys. So I try to address that with data, say, well, turns out you can. Secondly, that gun owners loathe these laws. These are onerous laws and they will not accept them. Well, we did polling to show that that's not even close to being true. The vast majority of gun owners support any sort of measure, including permit to purchase licensing, to keep guns out of the wrong hands. So that's what we try to focus on, is those two main issues that the other side is trying to effectively use to say, you can't do this, and it's just going to inconvenience gun owners, and so that's what we try to do.
Thank you. Another question?
We have an online question. And also, if you don't mind going to the last slide, it's the email for questions. And you can send your questions for people online to jlgordon, Gordon, at jhu.edu. And there's an online question that probably is mainly to David. How are you responding to the CDC report that underage drinking is at an all-time low? The alcohol industry is using this information for their advantage. How can we counter their propaganda?
These are deaths that shouldn't be happening. They're still happening. Yes, we've had success. Break our arms patting ourselves on the back that we're having success. But this is not a time to take our eye off the ball. This is not a time to sit back and say, okay, we're done. As long as we're losing 4,300 kids a year from alcohol, these are deaths that shouldn't be happening. It's not good enough yet.
Okay. We have one other online question. This one is from England, so we have a very wide audience today. The specific examples given have been in the context of public policy change. Do you have any views on advocacy to stimulate change within the industries themselves? We know there's a deregulatory tendency these days, and certainly that's what I'm experiencing where I am and in the issues I work on, obesity and food policy in the UK. So can we use the same techniques, and is there research that will work for this?
So that's a lot of where I spend a lot of my time. I work on alcohol advertising and kids, and I work on that mostly in the US. We have a very strong constitutional tradition that protects commercial speech. So the change here is going to come through changes in industry self-regulation primarily. Now, what gets the industry to regulate itself more stringently? A big fat spotlight on all the things they're doing wrong. How do you get that big fat spotlight? You do research. You release that research in ways that attract media attention. You make sure it gets into the hands of policymakers. Here in the US, one of the most influential constituencies are the state attorneys general. And so we make sure that our research gets into their hands. We also make sure that we're in contact with them so that we know the questions that they're interested in the research answering. I mean, that's one of the things about the research I do. I think a fair amount of the research that Daniel does is these aren't necessarily questions that, when I was 5 years old, I, was like dying to know how alcohol taxes work. These are questions that the policy debates require answers to. And so that's how we frame a lot of our research.
On guns, our center has tried to engage with different parts of the industry. There's the manufacturer side, there's the retailer side. With not a fantastic amount of success. A very substantial amount of guns sold in this country are sold to what I would refer to as gun enthusiasts. There had been a long downward trajectory towards gun ownership in the United States for a number of years. It's sort of flattened. The gun industry, however, has been thriving recently, mostly because they've convinced these gun enthusiasts to really stock up, buy a lot of guns. Those enthusiasts aren't all that keen about the industry doing anything connected to public health, public safety, or anything that might, from a school that has Michael Bloomberg's name on it. So we are not going to be able to engage. It's difficult, anyway, to engage with that industry for most parts of that industry. I guess I shouldn't be too broad. Steve Terrett is doing some wonderful work with some manufacturers who are making safer guns to personalize guns. On the retail level side of this, we haven't done work directly necessarily with the retailers, but as David was saying, the research is very critical. We've been able to show in our research that actually how gun retailers do their business matters in terms of how many of their guns end up in the wrong hands. And some of that was stimulated a long time ago with some litigation against some problem gun dealers. And we were able to actually document and publish studies where the voluntary actions by those retailers led to dramatic reductions in the flow of their guns into the hands of criminals. We did that in a case study in Milwaukee. We did a similar thing after New York sued a bunch of gun dealers, mostly from southern states. And we helped develop, in essence, a business code of safer ways to sell guns to reduce diversions. That we shared with advocates, and ultimately Walmart signed on to, and they adhere to those practices, and they're continuing to be pushed by advocates in a variety of ways. So we think what retailers do, what people in the industry do is incredibly important. We try to gear our research accordingly.
You want to go back to the live audience? Oh, did you want to say more?
I just wanted to add the issue of advocating to the industry. my industry at least would love to put me on their advisory boards, put me on their payroll, and so on. And I always keep in mind, in our case, there's just a huge conflict of interest that this industry faces. 75% of adult consumption is binge consumption. At least 2/3 of kids' consumption is binge consumption. Where earlier studies have found if people drank safely and underage drinking were eliminated, the industry would lose about half of its sales. There's a huge conflict of interest issue there. And so trying to change the industry's behavior, on the one hand, I have an open door, happy to meet with the industry whenever, but this issue of independence is absolutely critical, and we maintain an independent research voice, and my field, the advocates in my field, for the most part, maintain an independent advocacy voice so that we don't get involved in the industry's conflicts of interest.
Audience.
Hi, Joanna Cohn from the Hopkins Institute for Global Tobacco Control. This has been a tremendous session. Thank you so much. And I enjoyed the first slide with the 6 steps to going to the legislature. But I'm wondering about what comes next. And in tobacco control, both domestically and especially in low and middle income countries, we're finding that getting the bill or legislation passed is not enough, that the fight continues with the implementation. And sometimes it's even more important because more is at stake now. And so I'm wondering if you can speak to that.
Well, let me start. First, thank you for all your great work on tobacco. I appreciate that very much. Yes, the implementation is important in several ways after the bill passes. One thing that I think is very important is to celebrate it. Is to have parties, press conferences, everything you could do to celebrate the fact that this substantial public health measure has passed, and make sure the public knows that. And then I hear you loud and clear about implementation, and in fact, particularly on the Firearm Safety Act, Daniel and I met very soon after the bill passed with the top law enforcement folks to help them make sure they implemented right. And Daniel had some great ideas on how to do that, which he may want to talk about, and which they're implementing, which they're doing. Related to that is defending the law in court. The gun lobby has challenged the ban on assault weapons part of the law in court, and we filed an amicus brief, and we're helping to do that. So we're trying as much as we can to make sure the law is fully implemented. Similarly, the alcohol tax law, we want to make sure the law did not say, the alcohol tax law did not say the money shall go for all these great purposes. We worked after the law got passed to make sure that through the regular budget process, the law went to the public health goals we had identified, and it is happening. So absolutely implementation. But before I turn it over to David and Daniel, I want to make one additional point. We want to, with these 2 public health measures, also inspire the rest of the country. I mentioned earlier that David and I are talking with advocates in other states to try to raise the alcohol tax there. There is nationally, as you know, the Campaign for Tobacco Free Kids and other national organizations working to raise the tobacco tax. There really is no organization out there trying to encourage alcohol tax increases. So we hope that our Maryland model can make that happen. And starting with the kind of study that David did here, and there are several states where we're having those conversations. On the gun issue, we hope that the enactment of the fingerprint licensing here and the evidence that it's working will inspire other states to do the same thing. For their sake and ours, and I'd like to make this very important point. David mentioned earlier what happened in Missouri after they repealed their law. More guns used in crime were bought in Missouri. States that have these laws, the vast majority of the guns used in crime come from out of state. New York City, which has a much lower gun violence death rate than Baltimore, 90% of the guns used in crime come from outside New York. So once our law in Maryland is fully implemented, we believe that the vast majority of guns used in crime in Maryland are going to come from out of state. So for their sake and ours, other states, Pennsylvania, South Carolina, you name it, need to enact these same kind of laws. So we are hopeful that the success in Maryland will inspire other states to increase their alcohol tax and enact gun violence prevention measures like the fingerprint licensing. Daniel?
I'm so glad you raised that issue of implementation. In my line of work in gun policy, it's incredibly important. And our center has tried to devote resources and expertise towards those issues. In Maryland, Vinny was behind. This isn't the only success story on guns. Vinny has been successful in other years strengthening Maryland's gun laws. And there were two of those key pieces of legislation. One, banning of Saturday night special handguns through a handgun roster board process. That while that probably made sense and isn't a terrible thing to do in terms of having a process to identify which guns should and should not be legal for sale in the state of Maryland, advocates sort of took their eye off the ball after that law was passed, and particularly during the Ehrlich administration, a lot of it was really watered down, and a lot of guns were approved that should not have been approved. Had advocates been more engaged in the implementation of that law that our study showed was responsible for about 40 fewer deaths per year when we did our study. I think that's really critical. There was another key piece of legislation to expand background checks to private sales, and I think similarly advocates have not been pushing for law enforcement to identify those people who aren't following that law. And so it's so hard to get these laws passed. We cannot lose sight of what happens next. They're only going to work if they're actually implemented and enforced. And we've learned our lessons, frankly, the hard way in Maryland and in other places.
Let me just add two quick points. One is that the research job doesn't stop. Part of protecting the laws is the research that you do on the effect of the law, and so Vinny referred to it. We've got 2 studies going. We have to get them right, but we're close to a solid estimate of how much the alcohol tax decreased consumption of alcohol in Maryland. It did decrease consumption, so we'll have that study in place. And then one of the quickest indicators of effects in terms of outcomes are effects on sexually transmitted disease rates. And we've got a team at the University of Florida that is analyzing that data for Maryland. We've also got another piece of research that the Centers for Disease Control funded, partly from some of the things we learned from this campaign. The industry hits really hard on the jobs argument. So we have modeled, working with an economist at the University of Illinois at Chicago, we've modeled how many jobs are actually created by an alcohol tax increase. It turns out that alcohol tax increases, yes, they reduce jobs for the alcohol industry, but they create jobs across the rest of the economy. And so there's a net gain in jobs from alcohol tax increases. And we will have tools showing the gain for all 50 states in a number of different alcohol tax increase scenarios available on our website within the next 2 or 3 months.
Unfortunately, it's hard to believe that we're out of time. The time has passed so quickly, and there are students who are already coming in for their class. I want to thank Daniel, David, and Vinny. This has been a great presentation. And for people in the audience, the live audience, and the online audience, we will post the PowerPoints probably by tomorrow. And the archive will be available online at our website within a week or 2. So I want to thank you all, and maybe our speakers will come outside for a few minutes and answer any additional questions.
Sure, thank you very much.
And I want to remind people, our next Grand Rounds is July 16th on public health approaches to pedestrian safety. So I hope you'll join us then. Thank you.
Thank you.